reproduction for overpopulators. Here we have the female reproduction system. Here you can see that there are two ovaries. Inside these two ovaries are where the ovum is produced. These are the female sex cells. The oviducts are connected to the ovaries. The oviduct is lined with ciliated cells such that it can waft the ovum down into the uterus. The vagina and urethra are very useful because the vagina is a muscular tube that runs to the outside of the body. The uterus and cervix. So the uterus is a muscular bag with a soft lining. This is where the baby develops. The cervix is a muscular ring at the end of the uterus, and this holds the baby when it is developing. So this is the male reproduction system. So the testes is where the sperm and testosterone are produced. The penis and urethra allows urine to pass urine from the bladder or to release semen into the vagina while having sexual intercourse. Sperm ducts and glands are used such that the sperm can pass through the glands and mix with fluids which contain nutrients and other good vitamins. Fertilization of the overpopulators. Once a month, a female will release an egg cell from the ovary into the oviduct. This is known as ovulation. If a woman has sexual intercourse during this time, sperm cells may be present in the oviduct. Inside the egg cell, the nucleus from the sperm cell joins with the nucleus from the egg cell. This is called fertilization. This forms a fertilized egg cell, which is known as a zygote. Sperm cells will cluster around an egg when they reach it. Chemicals inside the sperm cell's head attack the cell's jelly coating to burrow inside. The fine hairs in the oviduct lining push the zygote along the oviduct, and as this happens, the fertilized egg divides into multiple balls of cells. Once a sperm cell is in the egg cell, the sperm cell expands suddenly, stopping any other sperm cells from burrowing in. The tail of the sperm cell which burrows in is left outside of the egg cell. The ball of cells implants itself into the lining of the uterus, and the female is now pregnant. Puberty of the overpopulators. So, what happens during puberty? Humans are not born with a complete set of sex organs. However, they usually start to grow between the ages of 10 to 18. When the sex organs do become active, males start to produce sperm in the testes and females start to produce eggs in the ovaries. This is the process of puberty and is caused by hormones. Menstrual cycle. So here we have a graph of the menstrual cycle of a female. Here, the progesterone and the estrogen have a sudden rise due to the uterus lining becoming thicker as the maturing of an egg cell has just occurred. The estrogen will start to drop as there is no need to produce any more egg cells as it has already been fertilized. Here is the progesterone keeping it leveled due to having to keep the uterus lining the same throughout until birth. So the menstrual cycle. So the menstrual cycle involves the preparation of the uterus lining so it can receive a fertilized egg. If an egg is fertilized, it will be implanted in the prepared lining. If it is not, the prepared lining will break down and is lost from the body. This is called a period. The placenta of the overpopulators. So here's a diagram of the placenta, and here we have the amniotic fluid, which protects the fetus from bumps shocks and also maintains a constant temperature within the placenta. Here is the umbilical cord, which runs from the fetus to the mother. This enables the fetus to get all the minerals, vitamins, and oxygen that it needs to survive, but it also excretes waste products into the mother. The placenta uses diffusion such that it can diffuse minerals, particles, and vitamins into the fetus. The circularity systems aren't connected due to if the fetus and the mother have different blood types, it could cause a problem. Pregnancy of the overpopulators. So pregnancy is the process in which a woman to endure around 38 weeks after successful intercourse and fertilization of the egg. The woman will also feel more tired and symptoms linked with increased hormone levels. Early in pregnancy, the woman's breast will feel more tender and swollen, and the area around the nipple will also darken and enlarge. Lastly, the woman's heart will be working a lot harder, resulting in higher blood volumes to supply the uterus, which supplies the fetus. So birth. Here we have a diagram of the stages, and once fertilization occurs in the woman's egg cell, the zygote and the embryo are fully developed. The process of pregnancy begins for 9 months. After 8 weeks of being an embryo, the embryo becomes a fetus, which is surrounded by amniotic fluids, by an amniotic sac, which is filled with amniotic fluid that protects the baby and has many other purposes. The placenta is connected from the fetus and the umbilical cord that anchors the fetus in the uterus, which allows waste and carbon dioxide to move from the fetus to the mother and nutrients from the mother to the fetus. During birth, the amniotic sac breaks and the fluid flows out, and the baby is pushed through the cervix and the placenta is excreted from the vagina. So birth control. This is what I think would control the overpopulated planet by using many types of birth control. So, what is it? Birth control is any method used to prevent pregnancy. This can include many things like contraceptives, abortions, or designated pills for pregnancy prevention. How does it help? By using control techniques, a couple is able to prevent the female counterpart from going through the stages of pregnancy. This also encourages the term of safe sex. However, it is taboo in some religions because it stops reproduction. Who can use it? Practically anyone can use it, ranging from teens to older people. This is mainly because of how easy it is to buy and where to buy. Some of the places like convenience stores, which everyone should have access to. But it's also very good because it can prevent STDs from spreading and can also help others who want to seek pleasure in sex. A form of birth control is called contraception. It's basically artificial conception, commonly known as a barrier conception. So what this does is that if a male to put a condom on, which is probably the most popular contraceptive device, it is wrapped around the penis, preventing any sperm from entering the vagina. If this were to happen, it would trigger the process of reproduction. Some other methods of birth control are abortions. Abortion is a procedure that prevents birth normally performed during the first 28 weeks of pregnancy. It is very controversial as some religions see it as illegal as it stops the reproduction of offspring. So how does it work? In some cases, a machine abortion process is used. This is a machine specifically designed to apply gentle suction. The tube is passed into the uterus where it gently sucks until the tissue is removed. Is it effective? In some places, it is impossible because not all countries